Greetings for everyone. Today I'll talk about the classification of ASA risks, or American Society of Anesthesiology risks. We know by classification 6 grades, and one letter is that is placed after the grade is emergency. Any of the grade can have an emergency like appendectomy or any other procedure that will have corresponding risks. What is the goal of ASA assessment? Presumption of time of recovery after anesthesia. Is this a mini-invasive or a surgical procedure that require only a few minutes, or is this a long procedure like 4 hours and require 1 day or more for recovery and the awakening of a patient and remove the oral tracheal tube? Also, we're assessing comorbidities and the measures that require to minimize risks, like preparing or placing a patient in intensive care and stabilize him hemodynamically and respiratory, and decreasing these risks. Also, it can be done in surgical office by giving corresponding tablets or drugs. General health status assessment and screening for is this patient for ambulatory or office-based surgery. How is the physical status correlate with mortality risk? For sure, if risk is advanced, the mortality risk is increased. Like mortality risk for grade 1 is 0.1. For grade 5 it's 9.4. Let's every grade what mean. For ASA 1, it represents general healthy patient without any organic, biochemical or psychiatric disease. It can be excision of phimosis, acute superficial tissue lesion, or any dermatological laser surgery. For a healthy patient, general healthy patient without any disease or comorbidities. ASA 2 risk represent a patient with mild systemic disease like mild asthma, which is intermittent one, well-controlled hypertension just with one drug, a well-controlled type 2 diabetes mellitus only with metformin 500 milligrams, for example, that will not have a significant impact on daily activity and unlikely impact on anesthesia and surgery. ASA 3 is more advanced risk, and it represents a significant or severe systemic disease that limits normal activity. What are the examples for ASA 3? It can be a renal failure or a patient on a dialysis, a patient with advanced cardiac insufficiency or a class 2 NIHA, acute exacerbation of COPD. It will have significant impact on daily activity and likely impact on anesthesia and surgery. Grade 4, it's advanced grade also. It is a severe disease that is a constant threat to life or require intensive care therapy. Patient is already in intensive care therapy. Examples can be acute myocardial infarction with walled infarction, hemiparesis, or respiratory failure that requiring mechanical ventilation. Very seriously ill patient with serious limitation on daily activity, and of course major impact on anesthesia and surgery. Grade 5 is a moribund patient who is likely to die in the next 24 hours. With or without surgery, it doesn't matter. In the next 24 hours, the patient will die. It's a very good candidate for organ transplant. And grade 6, it's a brain dead patient that can be confirmed with EEG or encephalogram, electroencephalogram. Examples can be patients with cranial trauma, decortication, decerebration. Very good candidate for organ transplant, but require signing of donor-like patient or according with relatives. And E mean emergency, as I told you. Thank you very much for your watching. Hope you enjoy it. See you.